Welcome back. It's time for our Africa Health Network update. Linord Moudou is here with today's report. And Linord, I understand you had an opportunity to speak with a very special guest.
Hello, Vincent. Yes, indeed. The First Lady of Zambia, Dr. Kaseba Sata, recently attended the Susan G. Komen for the Cure, honoring the Promise Gala at the John F. Kennedy Center for the Performing Arts here in Washington, D.C. It's an annual event that brings together heroes of the breast cancer movement. First Lady Kaseba Sata was presented with the Global Leadership Distinction Award for championing the fight against cervical cancer in her country. A longtime activist in the fight against cervical cancer, she was involved with the construction of the first cancer disease hospital in Lusaka. The First Lady currently serves as the chairperson of the Forum of African First Ladies Against Breast and Cervical Cancer. Accepting the award, Kaseba Sata thanked all those who are contributing to the fight against breast and cervical cancer in her country.
I accept this award and offer a special salute to all that have contributed to the struggle. In particular, I would like to mention the very hardworking men and women from the African Center of Excellency for Breast and Cervical Cancer in Lusaka. I would like to make a special appeal that as we leave this place today, we need to remember our tasks and opportunities to make a difference in the fight against women's cancers, especially in Africa, where breast and cervical cancer is anticipated to decimate a good number of its women. We need to act, and we need to act rapidly, and now. We need to save our future, and I believe that future lies with our women. Thank you very much.
And I had an opportunity to speak with the First Lady of Zambia. I asked her what the award meant to her.
It was really humbling to be recognized, but pleasant, I guess. You know, it's always nice to know that your efforts are being appreciated by others. But at the same time, you know, I look at this award as I said, it is just going to re-energize me to fight harder so that we bring dignity back to the many women that have breast cancer, the main survivors of cervical cancer. You know, there's no reason why, you know, people in developed countries should be living longer with the disease that is almost killing the entire nations in developing countries. I guess it will serve as a reminder that there's a lot more to be done in Africa.
Can you tell us how cervical cancer specifically has been affecting the women in Zambia?
I've been at the receiving end of patients coming in. As you know, my background is that of being a gynecologist. And for years, you know, it was really distressing to see women coming in late stage where you really can't do much. Breaking the news and telling them, oh, there's nothing much that we can do, go home and wait to die. We tried increasing the coverage so that people know about preventing efforts. But we found ourselves in Zambia with a situation that we had very limited screening services. And if anything, I think they were the preserve of the elite, people who could be able to afford having a pap smear. The issue of cancer, if you compare the developed countries and the developing countries, colon, lung is very common. Amongst women, you're looking at colon and breast. But because of the established screening services in developed countries, many lesions are picked up very, very early, and something is done for them. You come to Africa, breast cancer is the most commonly diagnosed, but cervical cancer is the #1 killer. and looking at the projections, because, with HIV/AIDS came the despondence of thinking, what are we going to do with our countries? The nations were being wiped out. There was a lot of investments that went in. Many men and women can now live quality lives because of the ARVs and what they're doing to the lives of these. But then comes the question of cervical cancer. Cervical cancer is strongly associated with HIV. In one breath, we're doing well, we're saving women, they are living longer, but we're not doing very much in trying to curtail one of the strongly associated cancers with HIV. And if you look at HIV, it's really changed the pattern of cervical cancer in the presentation. We're seeing many more young women presenting and really advanced cervical cancer. So HIV has changed the pattern. It's also changed the progression. It's also changing the way cervical cancer responds to treatment, even for those that are not HIV positive, because people are living longer. With more people living longer, we now have to start battling with non-communicable diseases, and cancer is one of those. And we need now to start focusing on cancers. And looking at the projections, I think in Africa itself, more than 250,000 women will be dying as a result of cervical cancer by 2030 if we don't do anything. And the estimates are now that it's going to double up. So we're standing at a point where we have to decide, what do we do? Do we tackle cancers in the same way we tackled HIV? And I think that's the way we need to be going.
The former President George W. Bush recently visited your country, which was the second time around. Yeah. Can you tell us what type of impact his visits have done to the country?
Oh, it's been tremendous. Zambia currently holds the second highest incidence of cervical cancer in the world. No one really talked about it. Now, when former President George W. Bush came to launch the Pink Ribbon, Red Ribbon initiative, and it was all about cancer, I guess people sat up and thought, wow, there must be something in this. So now, more people are acute to the sense of cancer of the cervix. Many women are actually asking for services. The demand has been overwhelming. We had started already training mid-level providers, and we reached a point where we needed to take cervical cancer screening to the point of contact, to the lowest facility. And the lowest facilities, the cadre you find is a nurse, is a midwife. So we took advantage of that and started training using the low-tech technology of using acetic acid and a camera. It's connected to a central server, which offers quality supervisory control. Every woman that is seen, they take a photo of the cervix and upload it into the system. Whatever decision they make at that point is recorded in the system. And at the central server, we have experts looking at these photos, look at the decisions that have been made, whether they are the correct decisions or not. The service is offering its see and treat on the same day. So it's really worked out well. And I know the Pink Ribbon, Red Ribbon were very encouraged, and they've pumped in money to increase that e-hub. So telemedicine has really worked for us, and we talked about e-health, and we are putting it in publication. So the coming of George Bush really put Zambia at center stage, and we're very grateful.
And I will have part 2 of my conversation with the First Lady of Zambia on Thursday, so be sure to tune in. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com. Vincent, back to you.
Well, thanks a lot, Linord. Be sure to watch for Linord Moudou's Africa Health Network report every Tuesday and Thursday right here on In Focus.